Hello, hello, and welcome back to another episode of the 2020 podcast, Canada's #1 optometry podcast. I am your host, Dr. Harbir Sayan. Thank you so much for taking the time to join me as always, guys. I'm so grateful. Always so grateful for you tuning in and taking the time to join us here. I know there's a million things you could be doing. So the fact that you're watching on YouTube or listening on Spotify or Apple or wherever this is, it means so much to me. Every time I run into somebody who says, hey, I listen to your podcast, I'm always so humbled. So thank you for taking the time. And as always, I always have a big request right off the top, which is if you could, please share it. If you find value from these conversations, and I know you will today, given the guests that we have on today. But if you find value from this, please share it. Send a text message to somebody or put it on LinkedIn or put a screenshot on Instagram and tag us and let everybody know that you are listening to this conversation. The more of our colleagues that we can get listening, the more of an impact we can have on the industry. So thanks again for doing that. And my incredible guest today is a returning guest. I'm so happy to have her back. Optometrist extraordinaire, entrepreneur, mother, wife, all these amazing things. Dr. Claudine Courey, thank you so much for coming back on. I'm always so happy to chat with you.
Thank you for having me. It's going to be fun. I really look forward to these chats. Absolutely.
It's always fun. It's always fun talking to Claudine. If you haven't, we are celebrating our 1 year anniversary of doing the same podcast in the same spot, which I'm going to tell you about in a second. We did this exact same type of interview 1 year ago here, but this is the 4th time Claudine's been on. So if you haven't listened to any of those previous interviews, please go back and check them out. We did one at Vision Expo East. That was our first one last year.
Yeah, in New York.
Second one was, where was the second one?
Quebec City.
Quebec City. Come on, look at this.
So good, right?
And then the third one was here in Toronto.
And then here again.
And here is at the Thea Pharma Canada headquarters in Toronto. And I want to give a huge shout out. I can't say enough nice things or enough thanks to Thea Pharma Canada for all their support, everything they've done for me personally, for the podcast, for my clinic, for optometry in general. Thank you so much, Thea, for everything. And we're here in the headquarters and we have some of the team here. You can't see them, but I would love for everybody here in the Thea Pharma headquarters, give us a little shout, a little clap. Let's go loud. There we go. Okay. So hopefully you hear that a little bit in the background, but a huge thanks to Thea. Everybody here at the headquarters have been amazing. And even all the way, I don't want to say all the way down to, all the way across to our reps in our office, Patty and Paula out on the West Coast in BC, how much support they've given us. And especially Paula I want to give her a shout out because just a year or two ago, she was named Rep of the Year by the BC Doctors of Optometry. So we're not messing around here. Thea's not messing around, that's for sure. So anyways, let's get to our interview. Dr. Claudine Courey. Yes. It's been a year since we spoke.
Yes.
And we've talked about a bunch of different things over the last couple of years. Entrepreneurship, we talked about beauty trends and makeup and stuff like that. We talked about dry eye, of course, given that you are truly a dry eye expert. But you have so many things on the go. Okay, you're speaking, you're presenting, you're setting up a booth. We're here for the Dry Eye Summit, by the way, here in Toronto, right? You're setting up a booth. You're obviously taking care of family. You're doing all these things. It's incredible. You're running this business that's booming. Like how do you do it? And like, what does your day look like? Day or a week, average week look like for you? How do you break up all those things?
Oh, I mean, it's hard to hear it because then I kind of realize what's going on. But the truth is, it's a lot of help. I mean, anyone who kind of says that they're doing any of these things and assumes that it's kind of just me, it's actually not the truth. So let's just be honest. There's a huge amount of people who are working together to be able to make all these separate things happen. And that's the truth. So it's kind of like a great team effort. And I'm very fortunate to have, in all those realms that you spoke about, just have really great teams to kind of support certain things. And it's give and take. Sometimes, I come out here and I gotta, do my thing, and other times I'm kind of the helper, so I'm fortunate, right? Don't you feel the same way, kind of?
Yes, but I like that. So I remember hearing a term, what's it called? Servant leadership is the term. So you're the leader, but sometimes you got to roll up your sleeves and you got to take the position of let someone else take the lead and you got to follow kind of thing. Is that kind of what you're saying? Is like you got to put people in position to kind of lead in a certain direction? Because otherwise, if you're trying to do all of it, it would be too much.
No, absolutely. But I've never heard that term, but I just mean like, I don't do it all, right, is the real answer to that question. And I kind of think there's a lot of question on like balance. How do you balance it? Yeah. I just find that there's no real balance, to be honest. You're just doing one thing well at a time. Or you could, what I always kind of say is you could do kind of everything, but you can't do everything well at the same time, right? So you got to kind of have to pick. And to be able to do those things, I have so many people that I rely on heavily to be able, right? Like you kind of rely on.
Well, yes, I'll get to that in a second. But like, there's one person I want to give a shout out to who's not here, sadly. And that's Anthony.
Absolutely.
Anthony, who is barred from now attending our podcast interviews, was sadly, no, he's just too busy. He's got so many things going on. But poor Anthony, for one of our interviews, I think in Quebec City, was it? I think it was Quebec City. We were recording and he might have been just behind the camera, but he was on, he had taken an important phone call. He was running a business.
He's working 24/7.
Right, but then Claudine's like, Anthony, get out of here.
Absolutely not. I would
that's how I remember it.
That's not the truth. Absolutely.
But it was something like that. Anyways, and now Anthony's never here for these podcast recordings.
He's just working. He's setting up the booth, you aforementioned booth.
Yes. But he's such a good guy. But I totally get it.
But he is definitely right. So we work together as a team. iDrop Shop is absolutely a collaboration. If not, he takes the lead on so many things, and I'm very fortunate to be able to work alongside him.
That's very kind. That's very nice. That's nice to hear. Okay, so that was the first part of the question, is like, how do you do it, right? You have a lot of help. That's very nice of you to admit that and be humble about that. There's a lot of people out there who would like to say, self-made, whatever, but I don't think that really, truly, I don't think that exists. Now, what does the average week look like? So I think I'm not the only person who's wondering. Obviously, you got a lot of people helping you, but you are in a lot of different places. So how do you balance? Like, how many days are you traveling kind of in a given week or month? How do you split your day between, like, when do you work on iDrop Shop versus how many days are you in clinic?
Yeah, so I think the truth is I've kind of figured this out over the last little while. And I guess the root of all of this is that monotasking, I think, is the secret. Yeah, okay. So not multitasking. I mean, like, you could do 4 things in an hour and kind of like half it and then be on your phone and then answer the call and whatever. Or you can devote an actual amount of time where you're fully concentrated on that one thing, accomplish it, and then move on. It's out of your head, And I feel like that's kind of the way I work. Like, here, I'm with you, we're doing this is all I'm doing. I'm like 100% present. And then afterwards, I'll be 100% present in the next thing. And it's kind of just these flowing things. So that would be the answer, to be quite honest. If I'm not doing like 600 things at once and kind of like all over the place. I'm really here. And then once I'm not here, I'm no longer here at all. I don't like think about it after. Although, I probably do. I do.
I thought you think about these podcast interviews like all the time. Never mind then.
No, I do.
Okay, so no, that's awesome. I think that's really good advice, and monotasking, blocking off time to really focus on one thing. I know I'm definitely guilty about the multitasking. Funny thing is, even to my patients, like I'll be in the exam room, patient sitting here, and I'll be typing. Patient will ask me a question as I'm typing, and I'll start answering it, but then I'll stop and I'll be like, you know what, just give me a second. I'm really bad at multitasking, so I'm gonna finish typing this, and I'm gonna turn over. So even in those kind of micro sort of settings.
And they appreciate that. I think hold on, give me 2 seconds, let me get this off my brain, and then I'm right there with you. I think they appreciate more than like a half answer while you're typing. And that's exactly a great description of what I mean,
But like you're doing on a bigger scale.
Yeah, and with patients too, same thing. Obviously they'll ask me a question mid, as I'm charting my notes, and I'm like, just give me 2 seconds, and then we'll, and I think it's appreciated.
So tell me, how many days are you in clinic?
It varies, like 3-4 days, depending on the week. Yeah.
I wouldn't have guessed.
I work.
No, I mean, sorry, not to, like, and no offense, but like you have so much going on. You're obviously, you have an amazing amount of expertise. Not that I don't think you practice clinically, but I just would have thought it's less given how everything goes. So up to potentially 4 days a week.
Yeah, that's like my core, right? I love optometry, and this is why I love doing this, and I love speaking and everything, to kind of share and in turn learn from everybody else. And really, the patient interaction is what I adore. So that's why I love kind of going to clinic, to really figure out in each situation sort of what's going on in that person, and kind of trying to like be a detective and figure out how to properly guide them and efficiently guide them. That's another, like, I love that, right? Because we could kind of do like 10 different treatments, but my goal is, how do I get them to feeling better in the quickest, shortest line,
You're right, it is, especially when you specialize, like, so to clarify again, Claudine does a lot of dry eye, but also a lot of specialty contact lens, scleral contact lens fitting. So we're going to touch a little bit on the sclerals and a little bit on certain aspect of dry eye. But when you do get into this kind of specialty care, I feel like there's a lot of detective work. But even in just primary care, there happens to be like, okay, why is this person not seeing quite as well as they should, or why are they getting this symptom? But when you get more specialized, there's a lot more of that detective work. You're looking at a lot more different types of data points.
Because you have a lot also of extremely bright people who have seen this patient before you, right? So there's a bit of a pressure on that in the sense that everybody, they're coming to see me after seeing a few different specialists. So they've already noticed, I mean, all these people were amazing who saw them before. So it's kind of like, what can I bring to the table? How could I help them more than what they've already been helped, you know?
That makes sense. So we're going to get a bit more into clinical conversation a little bit, but staying on the sort of the overall work-life balance type of conversation. I know we were talking about this a little while ago, and you were telling me, you know, what's changed from, well, actually, maybe I should ask you, what's changed from 1 year ago when we were sitting in this exact same spot a year ago, and the conversation we were having then to today, November 1st, 2024. What has changed in your life, or as far as your work-life balance since then?
I guess like so many things and nothing at the same time. I'm a huge learner.
Please be more vague.
Please dodge the question more. No, but in the sense that I'm a huge learner, and I always believe that when you know better, you do better, and I adore learning new things. So I guess if we had to, this is like asking me what my New Year's resolution was. Like if we had to kind of pinpoint the theme of the past year, maybe it's putting a little bit more boundaries so that I could be present and do that mono-focusing thing, I call it. So maybe just really honing in on every decision that I have to make. Is this really bringing me towards where we want to go, either personally or as a collective team? And if not, being okay just saying, I'm going to sit that one out. Maybe that would be it. Boundaries, maybe it might be the theme.
Boundaries. So boundaries. Tell me, so setting boundaries has allowed you to mono-focus.
Yeah, I don't know if this is a real
Monotask
thing.
was the thing.
I don't know.
It's okay. We'll call it. You
Focus on one thing.
You can, no, but why don't you just coin it? Yeah, exactly. You should TM that.
The Courey
and then you can start to, the Courey method of focusing on, let's see how well that goes. We can record another podcast when that blows up, okay? You can let me know. But setting boundaries has been what's been kind of key to allowing you to kind of focus more on one thing at a time. I feel like we were talking and you were saying, but part of this setting boundaries then has allowed you to maybe, last year when we were speaking, it was like, okay, I see patients, I come home, get the kids to bed, and then from this time till this time, I'm working on an eye drop shop. Is that still the same, or has that kind of changed a little bit for you now? Like as far as like working on eye drop shop till like midnight, and then getting up at the next time to go to clinic the next day, that kind of thing?
No, like I prioritize sleep because it's very important. And I think that there's waves, right? Kind of like I tell my patients, there's waves with the dry eye, there's waves. So leading up to Dry Eye Summit, of course, I knew that there was going to be a little bit more. But after, it's turning into a TED Talk, but after, you have the experience of being there. But, you could take like these little moments to kind of reset that won't affect anyone else, but really will help you. You know what I mean? So even if that's on Monday, starting a little bit later and having a second to go work out and like clear my mind and reset. I think these little things that everyone talks about and we're always like, I actually think they're important. I do. They're annoying, but they're important.
They're so important. There's so many like, I love quotes and I love to like say quotes, and there's probably so many I'm going to share as we go through this. But like, Robin Sharma is one of the authors that I love reading, and I post this page. If people follow me on Instagram, sometimes you'll see I post a page from, it's like a daily little paragraph of inspiration from it. But one of the quotes that it's like, if you don't stop for gas, like if you're on a road trip and you never stop for gas, eventually you're going to have to stop. You don't have a choice. Your car's going to run out of gas, right? You have burnout or whatever it is. So getting that rest and setting those boundaries and taking those breaks is so important.
And it's not cool to schedule and just be like, I'm dying, it's not, I don't find it's a badge of honor to be burnt out.
It was for a while, though.
And I think it's no
we're
longer,
kind of at the end of that now. There was a period of probably about 10 years there, maybe thanks to guys like Gary Vee and people like that.
I love Gary.
Yeah, it's just like work, right? And there's nothing else. And like, I feel like we're getting the end of that hustle culture kind of thing, because I think we should be talking a little bit more about balance, but obviously hard work's important. important. I was just, as you mentioned the sleep thing, prioritizing sleep, I remembered one of the kind of most famous people I've had on my podcast, other than you, secondary to you, was Haley Wickenheiser. So ice hockey player, women's ice hockey legend, right? And so, in her book and even on the podcast when she came on, she said how important it was, something she learned partway or like halfway into her career, like well into her career, she learned how important recovery was and sleep was. Yeah. And she actually wrote and said like sleep is, she's thought of sleep as a weapon, or recovery as a weapon. And so I think we need to think about it that way. If an elite athlete at the absolute pinnacle of a sport was saying that, I think we can probably learn from that a little bit too.
Us as ourselves, and also the importance of counseling our patients about this, even though we feel like it kind of might not be right. All these things that we talk about that kind of seem maybe, like, I don't know, either not for us to talk about or sleep and drinking it, but it matters. It matters.
Yeah. I always get a bit, that's a very good point. I actually get a bit uncomfortable having that conversation with patients where it's kind of like, okay, your eyes are always red and they're always uncomfortable. So how's your sleep?
Yeah.
And it's not very good. Or I work night shift all the time. Or, how's your diet? Oh, I don't eat very well. Or, some patients will be forthcoming with like, I'm drinking a fair amount or whatever it might be. And these different things, well, these things all matter.
Yeah. Exactly.
You could put the eye drops in however many times you want, but if you don't fix the foundational things.
That's it.
And I think many of us maybe are not quite as comfortable as we should be having that conversation.
It's okay. And obviously we have a certain amount of time, with patients. But I do talk about all these things, even though they seem, whatever they seem.
Yeah.
I mean, they don't seem anything to me because I talk about it all the time, but they're very important. So it goes with all the therapies we have. Counseling about this, I think, matters.
We're going to talk about a very specific aspect or patient type as far as dry eye goes in a few minutes, and I think psychology and counseling and all of that's going to kind of come into that conversation. But before we get into that, I'm going to totally change gears. All right, we're talking about work-life balance. We teased a little bit about scleral lens and that kind of thing. Not that long ago, I was looking at my phone. Actually, I have it here. That's Instagram. We don't need that. Okay. Oh, no, I lost it. Here it is. It was August. Here it is. August 5th.
Oh, yeah,
okay, but the conversation started days before that. But it was okay. So I want to talk a little bit about scleral lenses. We're not going to dive too deep into it, but about a year ago, I kind of made this mental shift that I want to do more specialty contact lens, okay? It was about a year and a half. It was around the time we first spoke in New York. I remember having that conversation with yourself and a couple other people, but like, okay, I'm going to get into this. And it was at first a big mindset shift and like, okay, then also I didn't even have a topographer or anything like that, and I wanted to do ortho-K as well. So we bought a topographer. Finally, I was like, okay, I fit one scleral lens here, maybe one ortho-K there. And I wasn't really picking it up, but earlier this year, I was starting to like kind of lean into it. And the interesting thing happens, you start kind of mentioning it to more people and you start having more confidence about it. And so people start to take you up on it. Yeah. Some of those people are kind of your more traditional, maybe simpler fits. And then some of them are a bit more, the more complex, because they like dry eye, for example. They've seen 2 or 3 other people and they're like, nobody's offered me a solution to this. Now you mentioned something new, scleral lenses. Well, maybe I'll check this out. So I find myself kind of treading in this new, environment that I've never been in. So I messaged you. I'm going to get into that in a minute, and you helped me out a lot. But what I'd like for you, because you're really heavy into scleral lenses. Yeah. Maybe for someone who's like me, who's kind of new to it, what advice do you have just generally as far as getting into I keep saying ortho-K because I'm leaning into ortho-K more recently.
That's good.
But scleral lenses, do you have any advice for somebody who's kind of more beginner stages of scleral lens?
Yeah, absolutely. I know that it can seem daunting at the beginning, right? It does. But if you are interested in it, I think your best resource is a rep of a scleral lens company. Obviously, there's tons of CE you can take to kind of get the first step. And it's great to know someone who does it, right?
Yes.
Like if you
I know somebody.
No, I mean, I could be that person, but it really is great. And I had, I did my residency, so I had that backing. But if I didn't, I would have loved like a phone a friend or someone you could text in the moment. But ultimately, it can be simplified, and you can start with relatively, regular corneas for dry eye. That's a great way to start because it's a regular cornea, so it's a bit of a less tricky time to fit.
Very interesting. So let's talk about that for a second. I've heard about people, I think we touched on this last time we spoke too, but let's give some advice to somebody out there who's listening who might be interested in this. I've heard about some docs using scleral lenses for dry eye. How does that work? What is the mechanism of action there to help with the dry eye?
Yeah, that's actually how I got into dry eye, is through this.
Through Scleral. So you did Sclerals first.
I was in Sclerals first. That's how I did my residency in that. And then my friend was like, hey, you want to come fit Sclerals for dry eye? And that's kind of how I got into here.
Okay.
But essentially, if we boil it down to the bare bones of it, somebody who would typically be putting their drops, it's me.
Wow.
It's me.
Cardinal sin.
Oh, it is a cardinal sin. Do we cut it out?
Claudine's phone was ringing.
It wasn't. It was my alarm.
Is this your first time on the podcast? I'm just kidding. It's fine. It's all good. We're going to leave it in there.
No!
I want people to judge you for this.
They judge me enough. Please take it out.
We'll see. Actually, I'm going to be the one editing this, so I'll see. It'll be my call at the end.
See how you're feeling.
See. Yeah.
Okay, that's fine.
Okay,
so, what was I even saying then?
You were talking sclerals for dry eyes. Okay, so your friend asked you to come. How does it work? Why
so if you boil it down, that's what I was saying. If you boil it down to like the bare bones of it, essentially, if someone's putting in drops multiple times a day, or if they have like a ton of SPK, you're filling the reservoir of the lens with a drop. Or a gel drop. I like a gel drop a little bit better. And then it's sitting on the eye all day. So the eye's swimming in this drop and really just healing the front surface of the eye. That's the kind of 101 of how it works.
Got it.
Yeah.
Any specific gel drop or drop in general that you find is beneficial?
Genuinely, I use Thea's Duo Gel. I mean, we're here now. Yeah, like what a surprise. Yeah.
I'm just kidding. I know. But I already knew the answer to that. I'm asking
Picking
you to just
on
do
me.
that. No. So I want to use that. No, that's a genuine answer. That's not just because we're here, but that is, and I know that's a genuine answer because, Claudine's like, tell them about this thing that I got open on my phone here. Claudine and I had this text message conversation, and I have this open on my phone. Okay, so I was getting this story earlier. I had actually sort of a more not simple, not easy in the sense of like the patient expectations, not an easy fit. Absolutely. As far as the corneal shape and all of that is not that bad, but this patient was like best corrected at 20/25 minus. I'm gonna read the text messages out to you a little bit, okay? So I called Claudine, we spoke on the phone, I was like, Claudine, I have this person coming in for their first like fitting and assessment of like, is that the right diagnostic, whatever, evaluation of the lens, so I can order the right lens for them, but I'm like not very comfortable in fitting sclerals. And Claudine kind of coached me through it, and then she sent me this text message with like Claudine's like 10 steps to fitting a scleral lens, and it's amazing because I followed these steps and they were great. So I'm going to read them very quick. I'm going to read them all. Unless there's one you don't want me to read. But
no, I mean,
I'll read them quickly and I'll give like the short version of it. Okay, step 1, consent form. Set expectations. Step 2, check the cornea. Step 3, select the lens. Step 4, put a few drops of a viscous drop, and in this particular case, Claudine recommended the Thea's Duo Gel. Number 5, check the eye, make sure there's no bubbles. Step 6, have the patient wait for 15 minutes. Step 7, do autorefractor. 8, refract the patient. Step 9, recheck the cornea and do the fluorescein and stuff the pattern because I don't have an OCT.
Yeah, exactly.
And then step 10, remove the lens and order the lens, do the calculations. And then step 11, very, very important step, text Claudine along the way, smiley face. Okay, so really, really important, step 11 was important because I did. So there are a couple of really key things in here. Number 1, using the Thea's Duo Gel, it makes the whole thing so much easier, right? And in this case, we're not specifically treating dry eye, but I put the Thea's Duo Gel in there, and like the lens just went right on the eye, no bubbles, no nothing. It was so much easier for the patient. The second thing, like nobody ever told me to do autorefractor, and I feel like almost like there's maybe some people out there judging me for doing autorefractor, but like I did it, and it was so much easier than the 3-4 people I fit before. Yes. Okay, and then I texted you 2 days later. Okay, update. Did the fit. Thea's Gel and autorefractor were a huge help. We were able to improve the VA from 20/25 minus, best corrected, to 20/20 minus for each eye. Yeah. So that's a whole line improvement. For like, from 2025 to 2020 it's not just one line. That's like a pretty significant change.
Yeah, but I would say also that this is like one of the hardest cases to fit in sclerals, right? Because you're not getting that big wow effect. You're not taking someone who, for example, has a cone and cannot see or sees very blurry to 2020 and getting the wow. Yeah. These ones are tricky, and you nailed it.
But thanks to you. And that's kind of why I wanted to share that. But even then, like, even though it was a one-line change, she noticed a significant change.
That's the most important.
She was like, I know for a fact, because we've been through this for a while. I've tried everything else up until this point to try to help her see more clearly. Yeah. But she's like, I know for a fact I couldn't read that line before. So she was quite happy. So we've ordered her lenses, and we're gonna get her back in soon and check her vision. So, but like that, just the process of fitting. Yeah. Adding the gel and doing the auto-refraction was a huge help. So I wanted to touch on that because I thought that was so helpful. And I know for a fact that there's at least one person out there who's like me, who's like, oh, I've never used a gel before. I've never done auto-refractor before. So something out there. Okay, I just wanted to touch on that. We're not really going to talk we're going to talk a little bit more about sclerals later, actually. Okay. But we're going to shift. We're going to shift gears. No, because I think there's something that you're doing that's quite unique with the sclerals that we're going to talk about. But we're going to shift gears more to dry eye, your other specialty. And like I feel like I won't say I've exhausted the topic of dry eye, but we've had a lot of guests on who've talked about dry eye over the last few years, right? It's been a hot topic for a while. I do a fair amount of dry eye treatments in my office, not to the same level that you do, but I know that our audience has probably heard a lot of podcasts on dry eye. So we're going to talk about a very specific type of patient. Okay, we're going to talk about patients who come in with neuropathic pain. And first thing I'd like you to do is, because I know these can be very challenging patients, whether our colleagues out there have a patient in their chair that they have defined as having neuropathic pain, or maybe when we go through the definition and the description of it, they'll say, oh, that's what the problem was with that patient. Because we've all had this type of patient in our chair, for sure. So why don't we go through, if you can, define it for us, like what is neuropathic pain, why does it arise, like what could be the causes of it?
Yeah, absolutely. So neuropathic pain is essentially perceiving pain in the eye with a non-painful stimulus. So it's a diagnosis of exclusion, but essentially and most commonly, I'll say that what I hear is these patients that will say they're very sensitive to light, almost that the light coming off of their computer screen is too much, or they're wearing sunglasses inside. Not like, oh, I go outside and it hurts and I put sunglasses. It's really a oversensitivity to light. And also another one is an oversensitivity to wind. You know those patients who say, like it hurts. I can't tolerate going outside. I can't tolerate, sometimes they wear goggles, like swimming goggles outdoors because they cannot tolerate any little gist of wind. So really these patients are in excruciating pain. I mean, there's a spectrum, but usually they're in a lot of pain. And then when we look at the eye, we see absolutely nothing. So your classic pain without stain is the definition of these patients.
That's the definition. That's like the 3 words. Is that 3 words? That's 3 words. Is without one word? Yes, it is. Okay, pain without stain. That's kind of the key phrase I think we've all heard, or many of us have. But so the patient's super symptomatic, sensitive, uncomfortable, but when we look at the eye, we put fluorescein on or whatever we're doing, there's like really hardly anything there. So what causes it?
There's a slew of, I mean, obviously when we talk about it, I think the number one thing that'll come to mind is probably a post-op, like a LASIK, something like that. Because unfortunately, there's been so many horrific cases of this, right? In the news, there's entire Facebook groups devoted to this, and rightfully so, because I think support is really important when you're suffering. So I think that's what comes to mind. But on the ocular side, there's so many other things. I mean, even chronic dry eye can lead to this. There's so many other causes, and it could also be systemic, right? Patients who are prone to migraines, patients who have fibromyalgia, anything else can kind of flow together. Like we know that the cornea is the most sensitive place, or one of the most sensitive places on the body, and like almost, I think it's like 300-400 more times sensitive than the skin. So if the patient's already extremely sensitive to, let's say, touch like this, imagine the pain they're going through in their eye. So I'm just really passionate about this because I see so many now, because I've seen 1 or 2, and I think I've been referred a few in the area. So over the past year, I guess I'd say I've had a huge influx of neuropathic pain patients. and have had to find solutions for them. But the truth is, it kind of ends nice, the story, typically.
Right. This one's got a nice ending, but there's a lot of times where, like just myself, I assume there's others out there who are like this too, but we try everything. We try the drops, we try the steroid drops, we try the other anti-inflammatories that we have, the other pharmaceutical agents that we have available to us, right? We try all these different things and warm compresses and ointments and everything else. And that patient just never seems to really feel better, maybe slightly better, but not a whole lot better. We do the treatments in the office, RF and IPL and all these things, and there's just limited improvement, and it can become frustrating for everybody, right? So I want to talk, and I know you are passionate about this side of the conversation as well, which is like the psychology of it.
Absolutely.
Right? So we're going to talk about the treatment of it, the medical treatment, but the psychology of it is so important. And I think this goes with a lot of dry eye patients in general. In a case like yours, and for me even to a lesser degree, but because we have certain technology and we offer certain treatments, we are getting referrals from other doctors or patients who will find us after they've seen a couple other people before. So you tend to get some of the more complex patients, and they usually come in pretty upset.
Yeah.
So I was wondering if we could talk a little bit like psychology from both angles. Let's talk first maybe from patient perspective. What is just generally the patient psychology when they have this type of an issue?
The number one thing, to be honest, is to sit down and take the time to completely listen to the patient's history. And by doing that, I think we even go back a few steps and it'll flag us to screen for corneal neuropathic pain. Because I think it's on us to pick up on these little things. For example, any history of eye surgeries. If they're saying that they're hypersensitive to these things, if they have any physical systemic conditions that are also chronic pain related, at least we think, okay, let me do that. And to screen, we could go into it maybe a little bit, but I have like a few little tests that I'll do over and above our regular dry eye screening. So there's the Ocular Pain Assessment Survey. It's the OPAS. It's essentially like an OSDI for pain. And it asks...
Specifically ocular pain.
Specifically ocular pain, which is really great. So kind of, I'll bring that out. And also the Alkane test.
So which is?
So the Alkane test is if there's nothing on the cornea, right, and everything looks fine, you'll ask the patient on a scale from 1 to 10, how are you feeling at the moment? Let's say they say 8 on 10 of pain. Then you put a drop of Alkane, you wait a little bit, and then you see how they feel after. And depending on what happens, you're gonna know if the pain is peripheral or has hit the central nervous system. So if the patient will be like, okay, yeah, oh my God, it's gone down to 3. We know that what we can do in office, helping them with their eyes, will have an impact. And then it's a very positive conversation.
Got it.
So we'll be able to say, listen, because it's more related to peripheral pain.
Got it.
If it doesn't change, which honestly, like, knock wood, hasn't happened to me yet, there's always been a bit of an improvement, then the pain has become centralized in the central nervous system, so the brain and the spinal cord, and that's a bit trickier and needs so either a pain management clinic, a neurologist, psychiatry,
I see.
for other more advanced testing. But what in our office, there's that, and you could also measure corneal sensitivity, right?
Got it.
So either like with something fancy, like a Brill or, crochet bonnet, or you could just like
Crochet bonnet?
remember, like from school.
No.
It's like this
You
pen.
went to Montreal. I went to an English-speaking school.
Cochette bonnet? I don't know. What did you call it?
I don't remember what it's called.
It's like this. It looks like a pen, and at the end of the pen, you kind of roll it, and there's like a fil, like a string.
Are there any other French-speaking
No,
people
but
now?
why do I speak French? I feel like, anyway, I'm fine. But it's like a little thing that comes out, and essentially you put it on the cornea, and then it'll measure the sensitivity of the cornea to the stimulus, right?
Yes,
so the shorter the
yes.
thing is, the harder you're pressing the, right?
So I just poke people in the eye. Is that equivalent? Or?
Poking's fine.
Yeah, good.
Yeah,
Alright,
you
cool.
heard it here first.
2020 podcast.
Right?
Always giving the best
Just
advice.
go. Yeah, no. No, but these are things that you could add. And then once we've figured out if there's a neuropathic component, then we could kind of take a different route. And also, sorry, that was the longest answer to validate the patient's feelings and emotions and what they're feeling and what they're going through. That's literally step number 1.
Got it.
Because they have usually been bouncing around. And I understand because they look fine, right? Or you've even tried IPL and LLT and RF and everything, and they're not feeling much better. But again, that's fine because we have to treat the baseline dry eye first. So that's all good that we did that. But if they still have symptoms, not to just say, okay, it's done. You know, there's other things that we could do. Yeah.
So step one, validate patients'
Absolutely.
feelings and symptoms.
Yes.
Acknowledge. Step two, cocher bonnet.
No, but that thing
Step
is
three, I'm
like
just
very,
kidding.
it's like,
I'm
you know,
just joking.
sensitive.
I'm just joking. Okay, no, but that step one is, okay, patient psychology, right? Obviously they're coming in, they're feeling a certain way. Many dry eye patients are quite upset, you know, and I have had the experience with a few patients who have told me about how seriously it affects their how they're feeling, and depression and other things that kind of come with that. And so we, you know, I'm sure many of us have heard that, but I'll flip that. Let's look at it from the other angle. Like, what's the doctor's psychology on this, right? You're looking at this patient. How should we frame this patient and how they're talking to us? Because I think it's easy for us to get a bit defensive when a person comes in and starts asking us a lot of questions, or saying like, oh, I've been to this clinic before, like, how are you going to help me, type of thing.
Yeah, I hear you. Because on the other side of the slit lamp, we're also people, right? And we also feel perhaps that, you know, I'm here exclusively to help, and this is my role, and I'm here only to do good. So if someone comes off as abrasive, it's hard to have that kind of interaction. And I think the secret to all of this is recognizing that the patient's behavior is a forward-facing expression of their underlying emotion. So a patient who will be, for example, abrasive or question a lot or anything like that, I mean, maybe they've had previous experiences where they didn't feel heard. Maybe they're scared and they feel like, am I going to live like this my whole life? I can't keep functioning. Maybe they're speaking so much because they want to make sure to get everything in, because they feel that, you know, I want her to know everything she could know so she could help me best. Or maybe they're just scared or anxious or sad or frustrated. But sort of as the doctor, to be able to see past any kind of emotional behavior that they're facing, because it's not about you, right? The patient just met you. It's at the end of the exam, it's about you. No, I'm kidding. But at the beginning, you know what I mean? Yeah. But if they just come in and they're automatic, you know that my patients who come in the most unsettled, I know require the most help and have tried so many things. And I'm so empathetic towards them, and I understand, because if you felt any kind of pain, I mean, even if you get like a paper cut, all you do, you walk around, you go to work, you do everything, but it's that gnawing pain in the back of your head, and it's just a little thing. But this is not a little thing. This is taking up their whole life. This is what they're seeing through. They're not able to complete daily tasks. Their quality of life is altered. And they'll come in and they'll say, you know, I'm a 57-year-old businessman. I've been functioning completely fine my whole life. And this happened. I did this surgery. And look at me, you know? And I'm not saying it's the surgery. I'm just saying, no kidding, he's frustrated. I genuinely don't blame them for feeling this way, because it flips their life upside down. But if we could flip it back up, wow, is it an amazing reaction? Yeah, it's incredible.
And empathy is kind of the key to all of that, I feel like.
Absolutely, absolutely. Understanding that what they're saying is absolutely real, that they're living through something that's extremely challenging, and that we're there to support them, and we have tools to help them. You know, and just not taking it personally. If someone is, for example, a little bit, I don't know, I just don't take it personally. I know it's not about me at the beginning of the end.
Not at the beginning, maybe at the end. But that's super helpful. I think seeing that, you know, pardon the pun, but like through that lens, like understanding that patient is coming in, they're probably extremely frustrated. They've probably seen multiple doctors before, and when they're expressing their frustration, it's not at you, it's to you. They just want to be heard, and helping them feel heard. I think that's something that I found like the most rewarding, is the patients who seem the most happy are the ones who just simply feel heard. Like, I've taken a few extra minutes, maybe they've even cried, you know what, they've just been able to kind of go through all their emotions and feel like they got it all out. And often in some cases, I don't think I've done anything more to treat. I maybe have done sort of the same thing, but given them a maybe more clear plan of some of the same stuff they've done before, and they feel so grateful for it.
Yeah, it's so rewarding. Absolutely.
So let's, like, again, that was kind of more discussing the psychology of it, how to approach that conversation. What about actual treatment? Because I know there's something exciting that you're doing that actually helps these specific patients, these neuropathic pain patients. I would love for you to tell me about that.
Absolutely. So at the beginning, we treat the dry eye disease, right? So that's kind of the first step. Make sure we rule out that takes away how much of the percentage of the irritation or symptoms. And then following that, we've recently, not so recently anymore, but we got a PRGF in the PRGF setup in our clinic. So that's plasma-rich and growth factors. So essentially the nurse will draw the patient's blood, centrifuge it, and put it through a bunch of steps. And at the end of this, the patient has little vials of their own kind of growth factors, let's call it. Or that's how I'll explain it to patients. I'm like, hey, hear me out, because this is going to sound, like something else. But I'll say, they take your blood and they spin it and they get the part of your blood that's super rich in growth factors from your own body and make eye drops out of this. And what this does is you put the eye drops and it helps regenerate those nerves that are firing to your brain that there's pain, when in reality there's no pain. And most of the time they're like, oh yeah, I heard about that. I think my cousin got injected in his knee, or they used it for hair. So it's not as weird, and I make the setup pretty big so that, because it is a bit funny to think like, okay, we're going to make drops out of your own blood. But these they've worked wonders.
Interesting.
Yeah, so they've been great.
It's funny you say that. So I've mentioned it to a bunch of patients. So I'll tell them, here's how much we can do for you. It's not the end of the road, but this is what we're capable of doing in our office. Beyond that, and then patients will say, well, what else is there? And I'll mention this PRGF or PRP. And most of them actually have heard of it, right? From skincare, from hair, from whatever. There's all these different places that they've heard of it. They just haven't heard of it for eyes, but they are fairly familiar with what it is to begin with. A similar kind of conversation with IPL, for example. A lot of people have heard of IPL. A lot of ladies in particular have heard of IPL and maybe even RF. And they're kind of like, oh, but interesting, you can do that for your eyes. And the same goes with this kind of this type of an eye drop. So you take PRGF, and how does that work? Like after, let's say, centrifuge, put into little vials, what's the dosing schedule?
Typically it's 3 to 4 times a day, and the series goes on for 3 months, so they get 3 months supply. And I'll kind of call them halfway through and then see them at the end, and it's done really, really well for these patients who have been able to really feel a lot better. I've had genuine, amazing stories, really, if I think of patients at the beginning and then how they are at the end with this. So it's kind of an added thing. So we're really happy to have that now in clinic and be able to offer it. And I think patients are also very appreciative to have a solution that they feel is also kind of holistic or natural, if you could call it that. I don't know the right term, but essentially they feel good knowing that it's their own body that's repairing their own body, which I love also. So that's really great. So it's typically,
there's a big, I won't say movement, but definitely patients do appreciate that. Even when you make simple holistic recommendations like warm compress and omega-3 and stuff like that, they're like, oh, that's natural. I like that. I'm supporting my body, just producing its own whatever it needs to produce. Obviously, this is taking it to a different level. So what's the next step with PRGF if we were going to make it more exciting and different? There's one more thing I want you to talk about.
So let's say those patients I spoke about earlier that really are complaining of wind or kind of a physical stimulus, right? They can't go outside, the AC, environmental factors bother them a lot. This is where I re-loop in scleral lenses, because it acts as a barrier. So it'll really help in those cases. And like I said, with that, we'll fill it up with the Thea Duo, which has the trailers, which I could also explain is really going to help work on helping the health of the cornea. And then in my really cool cases, I'll put the PRGF within a few drops within the scleral lens. And so we have the bandage, we have the drops that are helping to regenerate the cornea and the corneal nerves, I should say.
Amazing.
And it's been wonderful.
Within the lens, you'll have the Thea Duo or Thea Duo gel plus the PRGF.
Plus a few drops.
Just a few drops.
Exactly.
I guess because you're doing only one drop like 3-4 times a day, so you don't want to bathe the cornea in the PRGF.
Well, that, and also depending, it could be like not exactly, the to see through it. We want to make sure. It just depends on, it depends on the patient and all that kind of stuff. But essentially, we want to keep it, and it's still doing its job, right?
So so the patient does that themselves at home? Yeah. So when they put the lens in the morning, so you've trained them how to put the lens in. Now, this might be a person, like you alluded to earlier, basically spherical cornea, they don't have any corneal issues.
That would be great, but we do it in all different cases. But like if it's a regular cornea, it's just simpler even to do that fit.
So you teach them how to get the lens in and out, you send them home with it, and you say, okay, fill it with Thea Duo and 3 drops of your own blood, essentially, and then put that on your eye.
Yeah, well, the person, let's say, would have already had to do like a round of PRGF,
Oh, okay,
right?
okay.
You know what I mean? Or they're already scleral, you know? I won't start both at the same time because I find it's a lot.
Got it.
But typically, yeah, this
So
has
you
been
do the
really
PRGF
great.
on its own, and you're seeing some progress, but they're still sensitive, maybe not as much progress
Yeah,
as
maybe,
you want.
or
That's the next level.
like, yeah, or I'll just repeat another round of 3 months before going to Sclerals. But all to say, these are kind of all in our tool bag, and patients who weren't able to be functioning before
Yeah.
are completely functional members of society, and most
Wow.
importantly, they're
Sorry,
able
I'm
to.
kicking you.
No, it's okay. Most importantly, they're able to go back, right? So I always ask them, I still do the same thing, but I'll say like, what's the goal, right? What is your personal goal? And then we
Yeah.
loop back on that.
So that's something you told me last time,
Yeah.
and I find that so huge. Actually, and I started to integrate that to some degree, not as often as I should. But can you tell me about that again? So, because we talked about this, like sometimes let's not neuropathic pain patients, just dry eye patients in general. You know, sometimes you've been doing treatments for 3 months, 6 months, a year, and it's kind of hard for the patient to say how much different they feel.
Absolutely,
So I'm going to go back to my original, be like, here's what your complaint was. Do you still feel this? Like, are you able to read this many minutes? Are you able to look at your phone for this long? But you have a different approach, which I thought was really cool.
So we do everything, and I have all those measurements, but I'll just look at the patient and say, what is your dry eye preventing you from doing now that you wish you could do? That's my line. And my patients, like, they know it if they ever see this. You know, that's kind of my go-to line, because that is what personalizes an exam.
Right.
Whatever it is for one person, it's, I mean, rarely the same for another. And sometimes but I mean, what is really important to you? Because that's what I care about. I care that you are going back to your regular life. I care that my patients are no longer thinking about their eyes. You know, that is the goal. We shouldn't be feeling our eyes.
Absolutely.
We should just be going about our life and doing what we have to do, and our eyes shouldn't be felt. So if it is, then it's an added layer in everybody's already busy life, right?
Absolutely.
So we want to remove that.
No, I love that. So you set that goal, and I think
Yes.
that helps in a few ways. One is like when you go back, you can say, well, are you able to read this many pages now, or whatever your goal was, and hopefully they say yes. But also it helps you tailor the treatment and have a target to shoot at, right?
Absolutely.
Okay, now I know how I need to angle my treatment to get this result. Otherwise, we're sort of like a little more broadly, like I just want them to feel better, but that's
Yeah,
hard
but what
to
is that
gauge.
to them?
Exactly.
Or I'll see them and be like, how's the reading? You know?
Right.
And they're like, oh, you know, I did 2-3 pages, but I wish I could. Okay, we're almost there.
Yeah.
You know, but it's so personal to every single patient.
Yeah.
And I think that's also really appreciated, because it's going towards whatever they need in
Right.
their life. And that's the point too, right? I don't want to see all these metrics get better on my end.
Right.
I do, but I want them to say like, oh my God, you know, that when I hear like, I can finally do this thing, like then it's just the best feeling.
amazing.
I'm like, this is why we do what we do.
I love that.
Yeah.
Okay, great. So again, I didn't want to spend too much time on dry eye because I know we've covered this so many different times, but this specific topic of neuropathic pain, I think is maybe one of the more complex or challenging topics for us in the exam room, and we haven't covered it a whole lot on the podcast. So thank you very much for giving your insight on that. I want to change gears again, and we got to talk about kind of the basis of the 2020 podcast is entrepreneurship and personal development, business development, that kind of conversation. I don't do a ton of clinical conversation, so we got to talk about the more entrepreneurial side of things, right?
Absolutely.
So Eyedrop Shop is your baby from when did you start it?
Now it's 6 years old, this
6 years.
baby, yeah.
So let's talk about, let's do this as quickly as we can, because I know we have covered it. If you go back and listen to our first interview from March of 2023,
Yes, exactly.
that was when we dove deep into Claudine's journey in entrepreneurship and how she started Eyedrop Shop and went from there. But give us the super quick version of it, the TLDR, how did it start? Like what was Eyedrop Shop like in the very beginning? What was your role and what were you doing, and what is it now?
I was doing everything
Yeah.
in the very beginning, like every single thing. I was packing the box and dropping it off and doing the whole 9 yards, which I think is everybody's story as a kind of beginning business, and also has served me so well in our growing the business, because every step of the way I kind of know what's required, and not to be able to say, oh, I could do every step, but also to know what is a fair amount to anticipate from a person to produce. I think that's very good to be able to sort of gauge, right? And now we're like a nice little team and we're having fun. And but what hasn't changed, and this is not like a tacky saying at all, but the whole point of it has remained the exact same the whole time and will continue to remain the same, and that is to help people have access to high quality products that they normally couldn't. And we've also branched out into wholesale, so now we work with optometrists. Well, we always do, right? The clean beauty section, which has been really fun. We opened in the US. We did that 3 years ago.
Right. I think we talked about that before.
We opened in the US. Amazing. So that's it. We're always kind of thinking and innovating and thinking ahead. And it's so much fun.
That's amazing.
I adore this part of entrepreneurship. It's a ride.
That's excellent. That's excellent. So actually, I have a quote in my mind again that I want to share. It's sort of an offshoot. It's not really exactly in line with what you're saying, but I feel like it's relevant. But kind of to tee it up, you talked about like the boxing and the shipping and all these things, and you did all of that stuff. And sometimes that whole process can get stressful and tedious and that. But I think it's so important to learn from those things, and like you said, when you get to this point, you know how to do those things, you know what it takes to do those things right. But like I think sometimes we just want to get to like a certain end point and like not want to do those things, but there's a lot of value in doing those things, right?
Absolutely.
And there's a quote. So I know I'm taking a bit of a tangent, but again, I think it's relevant. I wanted to share this. I thought it is a good quote, but just to that point of like enjoying the process. I think even in whether as a parent or as a business owner or as a doctor, we all have our goals. We're all trying to reach a certain target, or specific to this analogy, we're all trying to climb a certain mountain, right? But I think sometimes we forget to enjoy the process, and like those tedious things and the whatever your routine might be with your kids. Sometimes you forget to enjoy those things because there's so much value in all of those things. And so the quote is, the only wisdom you'll find at the top of a mountain is the wisdom that you brought with you.
Yeah, there you go.
And I think the word wisdom can be interchangeable with, I don't know, peace. It could be success. It could be fulfillment. The only fulfillment or satisfaction you find at the top of the mountain is the one that you brought with you. Not brought with you from the bottom, but what you gained along the way, right? Yes. So I think just kind of as a something I wanted to mention too, I think you can vouch for this too, but like to all of our friends out there who are working hard, don't forget to enjoy the process. Don't forget to learn along the way. So that way when you do get to the top, you actually have something to enjoy. Totally. You can enjoy that view properly. And I think that's where I think you are now.
Oh, no.
Maybe, well, I would say you're at the top of, well, fair enough. You're at the top of one of those peaks. So tell me about that, at the top of this peak. There is a certain achievement that I wanted to kind of congratulate you on that you have achieved recently. Now, we're at Dry Eye Summit.
Yes.
And,
I know what you mean.
So, 5 years ago, when did you start eye drop shop again?
6 years ago.
6 years ago.
Yeah.
So when did you start getting involved a little bit with the Dry Eye Summit?
A few years ago, I heard that Dry Eye Summit was kind of around, and then it was a really big conference and stuff like that. And I wanted to attend, but I think it might have been COVID-ish, 2020 at that point, or the year before. So I always kind of thought, oh, that would be really cool. And then we attended our first show 3 years ago. This is our third year this year. So we did 22, 23, and now 24.
Right.
Yeah.
So when was the first time you set up a booth?
In 22.
22.
Yeah.
So 3 years ago.
3 years ago,
And this year is a whole different level. Tell me.
Yeah, so this year we're the presenting sponsor with 3 other presenting sponsors. But so it's kind of a nice little moment of working really hard and getting to be able to, kind of give back in a certain way. We have a lot of things planned, honestly, for this weekend, and it's really nice. It's really nice to be able to work with other great companies and
like Thea Pharma Canada.
Correct.
Okay. But so just like, just when we were talking on the phone, this one thing I wrote down, which I thought was such a it meant a lot to me as a friend. You're such a good friend, and I love to see you succeed. But 5 years ago, you said 5 years ago, we couldn't even afford to have a booth.
Oh yeah, that's true, because I remember talking to on the phone with Trevor, and he's like, yeah, you could come to Dry Eye Summit, it's X amount. And I was like, oh my God, Trevor, this is like, I'm a startup. No, we can't. So it's
That
nice
Trevor,
to see
that Trevor is always trying. I'm just kidding. Trevor's a great guy. Trevor's amazing.
I will stand up for him any day. But like, I was literally telling him, like, I'm sorry, man, like, this is no, but maybe, hopefully one day.
Yeah.
And so that's it. It's nice to finally get to the point where now we could be here in a big way and contribute to the dry eye field, contribute to education, contribute to all the things that mean a lot to me personally, and then Eye Drop Shop, so.
It's amazing. It's really amazing to see how much it's grown. And again, just that one sentence, that one quote alone, like it stuck with me when we were speaking on the phone a few weeks back. Yeah. That 5 years ago, you couldn't even afford to have a booth. 3 years ago, you were able to afford to have a booth.
We were here.
And just 3 years later, just 3 short years later, you're a presenting sponsor of this, like one of the most well-renowned dry eye conferences in North America. It's really amazing.
It's my favorite one.
That's amazing. Mine too.
Yeah.
Mine too.
Yeah.
It's really great. So tell me, I want to talk about Dr. Ashley Brissett. This is something you told me about, something else that's exciting for you right now. Tell me, who is Dr. Ashley Brissett for those who don't know her?
So she's a world-renowned ophthalmologist. She's actually from Toronto, and she.
Oh, I thought she's in New York now.
Yeah, so she did her studies at McGill, and then. Now she's at Cornell.
That's why you like her, because you're both McGill buddies.
No,
I'm just kidding.
She's amazing. Wait till you meet her. She's honestly fantastic on all fronts, and she's such an incredible clinician. Yeah. And so she works at Cornell. Ophthalmologist, yeah. And so we've known each other for a while, and now she's come out with her own clean beauty line. I see. So now we'll be exclusively distributing it. Through Eye Drop Shop.
Very
she's coming tomorrow.
Amazing.
She's going to present, and so it's really a privilege to have her here. And and that's another fun part, right? To be able to make these connections and meet such incredible people, learn from her as well. It's just, overall, I love this part. It's so much fun.
That's amazing. That's very cool. I do look forward to meeting her tomorrow, I think, probably.
Tomorrow.
Yeah, very cool. Okay. We're going to wrap up very soon. I have one other final question for you, but on the topic of like what's exciting, Dr. Ashley Brissett and her line. What else? What other products are exciting for you in Eye Drop Shop right now?
There's a lot of new stuff.
Or clinic.
Yeah, there's a lot of new stuff. We brought it all, so it'll all be at the booth, but when this airs, it'll be done. But essentially, we have a lot of new stuff. There's new kind of all makeup-y stuff, so.
Well, I feel like that's a big move right now, understandably, right? Like, so I get to bring samples of stuff back for my wife, and so I'm like, hey, can you try this now? Can you try this? Yeah. And so there's some stuff more recently that I brought home.
What did she try recently?
Well, recently, Blephasol Duo.
Oh, right.
And going back to our amazing rep, Paula, she's like, you have to get your wife to try this. So I'm like, all right, cool. So I was like, Pam, next time you wear makeup, you're going out or whatever, and try this out and tell me how it is. And yeah, she was pretty amazed by how well it removed her makeup. I was like, just use this as your like primary makeup remover and let me know how it goes. Don't like wash your face or anything. Just tell me how it is. And she was quite amazed. And actually, the first time she used it was last weekend. We were out for a Halloween party, so she was wearing a fair amount of makeup.
Right.
And then again, last night was Halloween, and so she did some like whatever basic kind of cat makeup or whatever she did, but she used it again, and yeah, she was pretty impressed.
Yeah, so that's new, right? And there's so many new things that are kind of now out on the market. So we're excited to kind of share all of that.
Awesome, very good. Okay, so go to eyedropshop.ca. .com, both?
Well, .com is in the US. Yeah, not .both. .com is in the US, .ca is in Canada, and then if you're an optometrist, there's a wholesale section to be able to access all this fun stuff.
Amazing.
And we're constantly kind of looking for new things, so it's fun.
Okay. Amazing, amazing. Eye Drop Shop, make sure you check it out.
Thank you.
Okay, so last time you were on was a year ago.
Yes.
And I know previously you've done like, for a long time I had these 2 questions. Oh, first of all, actually, before I get to those, how can people find you? So we did Eye Drop Shop.
Yes.
But how can people find you if they want to connect with you directly?
They could find me on Instagram, I think is a good one. So at eyedropshop or info@eyedropshop.ca is easy, and then they'll like redirect it to me and I'll answer.
And on TikTok, you're like a TikTok superstar.
Oh God, we're not talking about TikTok.
Why not? Is Eye Drop Shop on TikTok as well?
It is, yeah.
Superstar. How many, come on, what is it, like 20, 30, 40, 50K? Where are we at?
63.
Woo! 63.
Who am I? Like, what a joke.
Amazing. No, but it's amazing. I think actually, listen, for any optometrist who's looking to kind of build their online presence, like let's say on TikTok, for example, go look at Claudine's stuff. And I would recommend scroll back, because you figured out what's the right word? Like, you've kind of figured out a way to just like the type of content you post. It's good, educational. There's not a lot of, like, it's not the singy dancy stuff. It's just like educational content, but you've just figured out a simple way to present it where people obviously are engaging a lot with it.
Yeah,
It's
but
amazing.
the point of this whole thing was that it stemmed from guilt, if you want to know the truth, because my patients would be like, at the end of an IPL or at the end of all these treatments, be like, I wish I knew this before. I've been suffering for so long.
Right.
And I kind of felt bad holding all this kind of info in.
Yeah.
So that's why I think if any optometrist has the kind of desire to share their knowledge in this way, we're able to help people. Well, at least my mission is to help people go to their eye doctor and have a proper evaluation instead of kind of just picking up whatever they can from the pharmacy and like self-treating themselves, you know? So I'll always explain something, and if there's questions, I'll say, okay, well, go see your eye doctor. They'll be able to assess your personal. So it's been great because it really has helped people. I just laugh because I'm super silly on that.
It's great, but that's
Whatever.
but that's that platform,
That's
right?
the point, yeah.
But you know what? And for those of our colleagues out there who are kind of like TikTok, whatever. Look, I tell this story in lectures that I give, right? I give these lectures that are sort of like building your digital presence or e-commerce, that kind of deal, right? And driving people into your office using social media platforms. And I tell this very, very true story of when I took one of my daughters to the doctor, and we went to the doctor's office. It was like basically empty. There was one lady sitting like just a few seats down from us. We were waiting to go in to see the doctor. And a young girl, probably teenager, 13, 14 years old, comes out of the doctor's office and like goes straight to her mom. She goes, oh, the doctor said I have TMJ. Okay. And like not quietly, like, so this, I'm telling you what I heard very clearly, right? And the mom sort of looks at her like puzzled, like, ugh. And she goes, oh, it's okay. I already looked it up on TikTok.
Yeah,
In that like period of time between like when the doctor told her till when she came out to talk to her mom, she looked it up on TikTok. And if you search, if you do #medical on TikTok, there's over 20 billion views, 20 billion views of #medical on TikTok. So a lot of people are going out there to find this information. We may as well be the ones to provide it. Not some teenage girl who's trying to teach you how to put contacts in. There is that. There's a girl on YouTube who's got like 1 million views on her video of like her putting, Why is a teenager doing it? I don't even know. I didn't watch it. I just know that she is it. But like, it should be a professional, right? This is my point. So it's great that you're doing it. Okay.
Yes.
Look for Claudine on TikTok. Okay, so previously, you know that I would ask the same 2 questions for a long time, right? I'm not going to ask you those 2 this time. But for those who are kind of newer to the podcast, I would always ask, if we were to go back in a time machine, right? You did answer this, right?
I did.
Okay, if we could go back in a time machine to something that was a time that was difficult, like what advice would you give to yourself? And the second question was how much of what you've achieved is luck, right? Versus hard work. Okay, so do you want to answer one of those? Okay, cool. Okay, so the new segment that I'm like really pushing right now is called You're Welcome. Okay, you have kids.
Yes.
Have you seen Moana, the Disney movie?
Of
Okay.
course.
So you know the character Maui has the song, You're Welcome. Okay.
Yeah.
So the point is
Can
that
you
he's,
rap the whole
no,
part?
I cannot. Not even gonna try. So the point of the song is, though, for those who are uninitiated, is that he's like very egotistical and he's like, I've done all these nice things for you. You're welcome. But the point of this segment is for you to give us one, and I'll give you some time to think about it, but for you to give us one, like what's like one profound piece of advice or one like amazing quote that really is impactful. You're gonna share that, I'm gonna say thank you, and then you're gonna say you're welcome.
And then I'm gonna say you're welcome.
So, okay, so let's do, think about it, but let's do you're welcome.
You're welcome.
So what is
Okay,
one?
I have one.
You got one?
I have one.
What is one amazing piece of advice that you
This is actually an
you wanna,
amazing
like,
piece
look
of
at the
advice.
camera, or you want to look at me on this one? You can go back.
I don't know. You want me to look at the camera? It's
up to
creepy now.
Okay,
No, this is actually a good one. This is a great one. So listen to understand, not to reply.
Oh, I like that.
And that helps in all facets of life, but especially in patient care with exactly what we've been talking about this whole time. Listen to understand, just to absorb what your patient is saying, not to come out with what you want to say further. And then with that, your patient or human being you're speaking to will see that you're really there, you really care. And once the trust is there, the treatment will go so much better.
Amazing. Listen to understand, not to reply.
Yes.
Thank you so much.
You're welcome. I could wrap the whole thing.
Can you? Okay, let's go ahead. You want to look in this camera or this one?
No, we're doing it after. We're doing it after.
We're going to make sure we have a camera available at that time.
Yeah.
Okay.
No.
Okay, Claudine, thank you so much.
Thank
You're
you.
amazing. You're the
Thanks
best.
for
I can't
having
wait till
me.
we do another one of these.
Oh my
You know,
God,
the funny thing is, like, before we set this up, I called Claudine like,
This is
hey,
interesting.
like we should like, and big thanks to Mike Berg at Thea
Yes.
for you know, really encouraging us to have this call and this talk. I called Claudine like, hey, we should do this again. It'll be amazing here back at Thea, 1 year anniversary conversation. And Claudine's like, oh, what are we gonna talk about? Aren't people like sick of me by now? I'm like, are you crazy?
No, but I just felt like they heard me.
But there's always
3
something
times.
new. Like, look at how much we talked about today. And like, it
Yes.
took us like almost 45, 50 minutes.
Yeah.
And
No,
like,
I love
it's
coming
all
here.
practically new conversation.
It is.
It's amazing.
And it's always fun. I just meant, like, I don't want to, you know.
Okay. Well, if anybody's sick of hearing from Claudine, make sure you
Please don't
text
tell
me,
me. I
message
would
me
rather
on
not.
Instagram at harbirsayan.od. If you never want to see Claudine on the podcast again,
I don't have
please
that
message
thick
me.
skin.
I'm just
Please
kidding.
don't forward it
If
to
you
me.
love this conversation, please make sure you share it. Please make sure you message me. Put a screenshot on Instagram and tag us both. Let us know that you were listening. What did you enjoy about the conversation? What you took away? What was helpful? Thank you, Claudine. You're
This
the
is
best.
the best.
You're the best.
Thank you so
And
much.
again, of course, big thanks to the Thea team, Thea Pharma, for supporting the 2020 podcast, for supporting us in our clinics, and
Yes,
for supporting the
absolutely.
profession. One more big cheer from the Thea team. Woo! Awesome, guys. Thank you again for tuning in to the 2020 podcast, Canada's #1 optometry podcast. We'll see you guys in the next episode.